Should I just talk now? Oh, okay. So if you look at the X-ray, you can see that Sean's talus, that's the domed area, is in a valgus attitude, or it's canted. It's not straight. It's not, it's not perpendicular to the axis of the bone. It's actually at an angle. And also you can see this large cyst that's developed in the bone, and that's from the significant arthritis. He is bone on bone here. And again, you can see the multiple osteophytes or kind of bone chips everywhere. And again, this is probably one of the most severe cases of ankle arthritis I've seen in 12 plus years of practice. In Sean's case, I would remove the screw. I would fuse his ankle, and of course I would have to change the position so it was in a correct attitude, and that would probably entail lengthening the Achilles tendon and cutting the heel bone to slide it underneath his leg. So if you can imagine his heel bone is in this area, it's not anywhere near underneath the leg, it's out over here. So we would cut that and move it back over as well. We can do this with hardware. We can also do this with an Alizarov frame. So you've probably seen people with halos around their heads. We sometimes put that on legs. So there are multiple ways to make this happen. The Alizarov frames are, they actually allow for a greater amount of compression and thus a greater fusion rate than just using plain hardware. So that's what I do for Sean.